Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Aortic Angiography. Introduction. Sometimes people have serious problems with the biggest blood vessel in the body, the aorta. An angiogram is a test that helps healthcare providers look at the aorta to decide what kinds of treatment may be needed. If your healthcare provider recommends an aortic angiogram, the decision whether or not to have this procedure is also yours. This program will help you understand better the benefits and risks of this procedure. Anatomy. The aorta is the biggest blood vessel in the body. It starts at the heart, curves in the chest, and goes down into the abdomen, where it divides into two other arteries. Along its course, blood vessels branch out of it to take blood to the arms, neck, brain, intestines, kidneys, legs. Symptoms and their causes. Cholesterol deposits that accumulate in the aorta or its branches can cause the aorta to narrow. A narrow aorta does not let enough blood go through the blockage. This causes blood flow to decrease. This is the cross-section of a normal blood vessel. This is the cross-section of a blood vessel clogged with cholesterol deposits. This decrease in blood flow could cause severe arm pain and possibly weakness if it occurs in arteries that go to the arms. It could also cause the same symptoms if it occurs in the arteries that go to the legs. When the blood vessels going to the kidneys are involved, kidney problems and high blood pressure can result. Blood vessel abnormalities called aneurysms can form. This ballooning of the blood vessels causes their walls to be thinner than usual. This condition can cause bleeding that could lead to death. There are other abnormalities in the blood vessels called arteriovenous malformations, also known as AVMs. These are abnormal tangles of blood vessels that could also bleed and cause death. An angiogram helps show the aorta and the blood vessels that take off from it and helps detect any of these abnormalities. This is an angiogram of a normal aorta. This is an angiogram showing an aneurysm of the aorta. Notice how the aneurysm makes the aorta balloon larger than the normal aorta. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Procedure. An aortic angiogram is usually done on an outpatient basis. This means you can go home after the test is completed. The procedure usually takes about an hour to an hour and a half. This procedure is done while you are sedated. There is very little pain involved. You are asked to lie down on the X-ray table. During the procedure, your heart rate, blood pressure, and vital signs are continuously monitored. The groin area is then disinfected and made numb with a local anesthetic. A long tube called a catheter is then inserted through the skin into an artery in the leg and threaded all the way up into the aorta. Sometimes, depending on the healthcare provider's preference and the state of your arteries, the catheter may be inserted into a big artery in the underarm or the upper arm instead of the groin. Dye is then injected into the arteries and X-rays are taken. The dye makes the arteries visible to the X-ray machine. When the dye is injected, you may feel some warmth in the face or other parts of the body. You should stay very still during the X-rays to allow good, sharp pictures to be taken. After the X-rays, the catheter is taken out and pressure is applied where it went into the skin to ensure that there is no bleeding at the site. If your healthcare provider uses a closure device, you will lie flat for about 2 to 4 hours. If not, you will lie flat for 6 to 8 hours. You should not bend the leg on the side of the groin that was catheterized. You will probably not be able to drive after the procedure and will need somebody to drive you back home. Risks and complications. This procedure is very safe, but there are several possible risks and complications. These are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. X-rays are used during this procedure. The amount of radiation during this test is deemed safe, but this same amount could be dangerous to unborn children. It is important to make sure you are not pregnant prior to an elective radiological test. Infection at the injection site is rare. The catheter placed in the artery can rarely injure the blood vessels of the body. This may cause decreased blood to the leg or arm involved, which may require an operation to re-establish blood flow. The insertion can also cause injury to a nerve in the leg or arm, depending on where the insertion was done. Strokes resulting in permanent paralysis, speech problems, and possibly death are rare after an aortic angiogram. Some people have allergies to the iodine dye used in this test. Make sure to tell your healthcare provider about your allergies and about any possible reactions to any sort of dye used on you in the past. In some people, dye can cause kidney failure. If you have a kidney problem, you might be at a higher risk. After the aortic angiogram, make sure to contact your healthcare provider in case of any new symptoms, such as redness, fever, numbness, weakness, swelling, bleeding at the puncture site. Also call your healthcare provider if you have angina or chest pain. Your healthcare provider will tell you how soon you can go back to work. This depends on your medical condition. Usually, you should be able to return to work about a week after the procedure. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. The aorta is the largest artery in your body. Other arteries branch off from it to supply blood to nearly the entire body. The aorta can be affected by several kinds of diseases, such as cholesterol deposits, which clog it and slow down blood flow, aneurysms, which balloon out and cause its walls to be thin, and AVM, which are tangles of blood vessels. The aortic angiogram is a test that helps your healthcare providers look at the aorta so that problems, if any, can be located and treated. Aortic angiograms are very safe. Risks are low and complications are rare. Knowing about them will help you detect them early if they happen. Thank you for using Explain.